Good day, everyone. On behalf of the Innovation Institute for Fan Experience, a warm welcome to all our listeners from around the world. We've got a terrific forum planned for you today as we explore how Wembley Stadium in London, UK, has been managing COVID-19 risks. Today's discussion is the second installment of the Coronavirus Playbook, which is a four-part series created by the IAFX Medical Task Force. The series is designed to explore how the sports and entertainment communities are responding to the pandemic. It is broadcast every Wednesday at 12 p.m. Central Time in the United States and broadcast around the world. It is worth noting that anyone who registers for one of the four sessions is automatically registered for the other three in this series. I'm Dr. Till Jolly, Chief Medical Officer for Aveshka and your moderator for this forum. Aveshka Consulting is powering this series. Each week, the series will bring subject matter expert leaders together to focus on current and emerging health and medical risks in sports and entertainment for venues, athletes, performers, fans, vendors, and staff. Before we get started, a couple of quick housekeeping items. Today's session is being recorded and will be available on our Return to Work, Play, and Spectate podcast, now available on Apple, Spotify, and Google. A video of the session will also be available across our social media, Facebook, Twitter, and YouTube channels, and at IIFX_global. Our session last week focused on youth sports, was very successful, and is also available for viewing. Your microphones were automatically muted when you joined the webinar. We ask that you keep them muted so that our panelists can be heard clearly. You're welcome to ask questions using the Q&A feature, which is located at the bottom of your Zoom window, and not the chat feature, although there are people already chatting in the session, but please use the Q&A feature, and we'll be following that for questions as we go along. Please know you have the ability to adjust the view of our proceedings by making the picture appear as a full screen. If your internet connection fails, you can log in again and you'll get right back in without any difficulty. You may also call into the session using the numbers in the email you received. Please ensure to mute your phone. You're invited to participate in our polls. When a poll is open, you'll have up to 2 minutes to complete the poll. The results of this anonymous poll will be visible to everyone. Again, thank you for participating in this webinar. We think you'll find it informative, timely, and useful as you plan to work, play, and spectate. Now, a little bit about COVID-19. We're all facing challenges, and rather than share with you all the data that we all see from around the world, from the UK, from the US, and from other places around the world, a little perspective. On March 11th, the World Health Organization declared pandemic. Before that, on January 31st, the US declared a public health emergency, and countries around the world around that time were facing threats from a worldwide pandemic the world had not seen since 1918, not within any of our lifetimes. The Wembley Stadium in London is a world famous and very important venue in many ways, and faced these challenges head on. And we welcome their staff today to share some of what they have learned and continue to learn from the challenges that we're all facing. I'm going to introduce each of them individually. You see them on the screen. You'll hear them all speaking about their roles. First will be Liam Boylan, the Stadium Director, Mike Patterson, who's Chief Medical Officer for Venues and is also a practicing consultant in intensive care and emergency medicine with the National Health Service. Mark Cutler is the Medical Manager for Wembley, and Tom Wyke is Stadium Health and Safety Manager. Now it's my pleasure to turn this over to Liam and their team to share what they continue to learn through these challenging times. Liam.
Thank you very much, Till. And good afternoon, everybody. For us, it's the evening. We're just gone 5 o'clock, but we're really honoured to be able to talk to you guys and share our experiences and what we've done. So I'll go through our presentation with you now. So what we're going to talk about today, I think the first thing that I want to talk to you guys is just to give you a bit of a base of who we are. I said, I'm sure you've all heard of Wembley Stadium, should hope you have. But it's actually understanding what we are as a building and obviously the challenges that we then faced when COVID-19 struck. So Wembley Stadium itself is a multi-purpose venue. We do everything from football, as you know, it's soccer. That's our primary use inside the stadium. We're also the home of the Football Association, so their offices are based within the stadium over 4 quadrants, about 500 people who are based here. We're also a university campus, the UCFB, which is the University Campus for Football Business. They're based here through normal periods, so September through till May. And And then we're also a conference and banqueting venue. So we're busy all through the year. Events wise, we have approximately 35 major events inside the bowl, which would have something in the region of 2.5 million visitors coming into the stadium. And it gives you an idea of what we are. We're also going to talk with the team that I brought with us for here. So Mike Patterson. Mike is our CMO. He's going to go through, as it says there, what we're emerging from COVID-19 and the clinical challenges. I'll then bring in Mark Cutler, who's our medical manager. And he'll talk through how we actually implemented everything that was happening and what we did for from post-March going forward. And then finally, I'll bring in Tom as our health and safety manager. Tom has to interpret everything that comes his way, and with the other guys sort of help us understand the way forward, and he'll give you his, and then I'll give you a final just on what the future will look like for us. So this is Wembley Stadium, based within our local authority called Brent. As you can see with everything around us, the challenges are there straight away when it came to COVID. Whilst we are the stadium with 2.5 million visitors, those 2.5 million visitors will be walking through a large residential area. That whole area you can see, fairly new, ever expanding. Every time I blink and look outside, there's another tower block that's gone up. A normal, very keen developer who is developing on that land. We actually don't own any of the land outside the stadium. So unlike the US stadiums where you have all those wonderful large parking lots that you have, we don't have that. We've never owned that area outside. We only own the actual outer concourse outside the stadium. So those developers are there. That's about 15,000 residents that suddenly appeared on our doorstep with this new development, which has its own challenges as well. But you can see that for your own, just look at that. So the stadium, 90,000 seats, over 5 public levels. Large playing field in the middle, 105 by 65 meters. We've built, the actual levels are based on 35,000 lower, 17 in the middle, and 39,000 upper. So it gives you a scope of the size of the stadium itself. To go around the stadium is 1 kilometer to go around. The arch that's above us there, that supports the roof, is obviously an integral part. It's not just a bit of aesthetics to identify us. It's there for that supporting the roof. You can actually fit the Eurotunnel train through the arch. That's how big it is. Again, you're sort of seeing that estate that's immediately outside the stadium. So it's a big beast of a stadium. I'm sure many of you have got stadiums similar size, and with all the challenges that we look at. So I wanted to talk through when we're planning events, what it used to be like before COVID, just to give you an idea of what the changes are and how we've had to change. So before COVID, we'd start an event normally about 6 months out would be the first time that we start to look at announcing it. And I think the important thing to know is that as it was before COVID, the events team would be the main base for setting that event up. They would be the team that had all of the pieces of the jigsaw. They would gather all of the teams together and they would lead. They would talk through everything that was needed to put the event together, to get the on sale together. They would work with the ticketing. And so we would have these sort of 26 weeks out, announce the event, 25 weeks out, put the event on sale. There we go, brilliant. Then 16 weeks out from the event would kind of be the first major planning meeting. Again, the event manager's holding that together, starting to talk to all the in-house teams, starting to make the local authority aware of what the event looks like. If it's a sort of a business as usual event like football for us, soccer, fairly straightforward, but if it's going to be something more challenging like concerts or NFL when they come to town, we start to explain exactly what that is and also start to get information from the event owners. 10 weeks out, we're looking at staff booking, teams begin to finalise staffing requirements, planning meetings, and then we get to the event delivery. The reason why I'm talking about this, because this is obviously a part of your business as well, was, and I would have thought you'd probably be in the same boat as we've been, is that the 16-week point would probably be the first time our medical team come into play. They're going to attend that first major planning meeting. They're going to be a bit reactive, listening to the information of what's going on, and then starting to plan out what it's going to look like for the delivery. 10 weeks out, they're booking their staff as well. Then we get into event delivery, and they obviously become a major part of the actual delivery because, you know, medical is required on that. But in the planning stages, not so much. They've been listening. They've got their own planning going on, but for the stadium's point of view, they're an incredibly important cog, but they're just sitting there as one of those sort of receptive teams listening in. That's changed completely for us now. They're now at the vanguard. They're now leading on everything. So if you go back to that 26-week point, for us going forward, they're going to be one of the major teams there. They're going to be leading on it. So for the games behind closed doors, for the return of crowds, and I think even post-vaccination, when that comes out, they're now going to be integral to that first part. They're no longer going to come in halfway through the planning. They have to lead on it. So I think if I hand over to our CMO, Dr. Mike Patterson, Mike can go through things in a minute. What I'm going to try and show you quickly, if it does work, I'm not sure the lag if it will. We have a quick video, just a light-hearted video, just 1 minute long, just to show you what events were like at the stadium. So this video covers a 6-week period, which covers through our major football finals and going into a concert, but gives you an idea of what we were delivering when we still were allowed a crowd, because we did love a crowd. And then we'll hand over to Mike to explain how all that's changed now and what we've had to do now post-COVID.
Yeah, so thanks for letting us have a long. As Liam quite succinctly, but our experience is very similar to most major event spaces worldwide with this. Medical provision for mass events has always been something that sits in the background. And the analogy that we always had at Wembley Stadium and at the Football Association in England is that a good medical service at a stadium or mass event is like a referee for a soccer game. A really good referee, the game will finish, you won't even know that they've been there because they've managed everything, they've been in the background, they've been responsive, and you're nipping things in the bud when they happen. We are in one of the highest density medical emergency per ticket holder event spaces in Britain or Europe, in that we have, for the small amount of events that we have, up to 40 a year, we'll have around 1,000 patients that we'll see in our medical team, 100 of which of those will need an emergency conveyance to hospital, and about 50% of those will be a sort of time critical trauma or cardiac emergency. So actually we work in an environment with an in-house pre-hospital team that we're lucky we already have that internal governance and setup. But as Liam said, we're often in the background. And I guess one of the things I wanted to contextualize our experience as a clinical team was how we went from being a front of house, a back house support bit of the organization, although one that was very busy and lucky enough to have established foundations of command, control, governance, and connections with the rest of the organization, but then became very front of house, both in the planning and delivery of the events. So I kind of wanted to divide our experience into two parts. One was the public health element of it, which I think we've all become very okay with. I mean, I'm an intensive care and emergency medicine physician by background. There's a very good reason I didn't go into public health, because I just don't have the attention span or intellect for it. So I've, like everybody, have been like catching up really significantly. And I think the one thing that I would say is that we're still in a position, even though we've been doing this for months and months now, of learning with every single meeting we have, every single event that we have. We're still, making this up as we go along and trying to do the best and learning as we move. So we have the public health challenges that are moving. And then on the other hand, something that I think most people on this webinar will be used to, which is stakeholder management. And that's really the bread and butter of working in a multidisciplinary team and providing a sort of quality safety for sports, entertainment, and media. So the public health thing, I guess the ever-changing landscape is the hardest thing. Now, I went from working in an intensive care unit in London that had gone from having 35 ventilated patients to 135 ventilated patients in a 4-week period, and doing that for 6 or 7 weeks. And as that settled down, as Liam kind of mentioned when we were setting up the webinar before you guys all joined us, then suddenly we get a message saying, right, it's time to get Britain back to football. And this became a very important objective for the emergence of us from this significant lockdown. So a lot of what we did then and are doing now is staying informed and ahead of policy making. Now, I think it's hard to do that because you have to start with, because we didn't know what the policies would be. But I think importantly, what we're learning now is there are certain key elements to how you can predict what will be permitted within law and what you will be asked to do to deliver your events, such as understanding, prevalence measures and how they track with health and safety legislation in your areas. That kind of moves on to interpreting national guidance for your own practice. Now, there were two other leagues within our sort of space just before we did. That was Korea and Germany. Now, Korea and Germany couldn't be any different in both the way that they would deliver sports administration culturally to the UK, and their government approach to public health is completely different as well. So the UK has a very current executive has a very libertarian approach to policy making. So where our colleagues in the Bundesliga in Germany, very, very specific, almost line by line guidance as to what they would do specifically to deliver their events, we were given very broad ranging implementation policy. And the message we were getting, and that we still get, is that that policy is an umbrella under which we need to best implement that and interpret it within our own areas. So that's been quite challenging to try to remain sort of safe and responsible while we do that. And I guess that leads me on to and again, then we have a very nationalized system in the UK, or certainly in England. So we don't have federalization. We don't have close, well-defined regionalization, although that's now an element of public health policy that we're having to struggle with. But as far as Wembley is concerned, we were right in the epicenter of one of the worst density mortalities in the world at the time that we were delivering football. And the borough of Brent was the fourth worst affected, at the time that we delivered our first football game, was the fourth worst affected COVID area in Europe. And so obviously things have changed significantly since then, but that is the sort of pressure that we were trying to deal with. And we were trying to balance that responsibility that we had, and that I'll get back to later on, between our national responsibility as a landmark stadium and the Football Association, one of the national governing bodies of sport that's the highest profile in our area, against our very tangible local responsibility that we have with the Safety Authority Group, our local council that we sit with all the time. So trying to remain on that front foot and find a balance between listening and learning from others. So we would be scrambling around, and the National Event Medicine Advisory Group, which is a group of clinicians that work in event medicine, setting up Zoom calls with them, finding out what different stadiums would do. We were lucky in that we were having a parallel launch with the Premier League and the English Football League, so those top tiers of competitive football. So trying to bind together with them and work this out as we were going along and trying to reduce the amount of variance in what we were doing. And then, but also having that responsibility as the national governing body, to learn and to innovate going forward, and to be balanced in the way that we did that. So becoming comfortable with that we're all learning as we're going along, very, very early on in this process. And then, of course, remaining a responsible national organization. So again, just to move back to what I was describing before, we are lucky. Our medical team from an under 16s international game that we're hosting at a venue somewhere in the north of England, to what we were planning to do, which was to deliver the European Championship final at Wembley Stadium. So, all ends of the football spectrum delivery, we have a medical team underpinning that. It's invested in, it's in-house, and therefore we started to have some of the architecture that one would need to deliver this sort of integrated multidisciplinary clinical governance. And so one thing that we kept going back to was trying to take COVID policy and not make it discrete, trying to integrate it into every little bit of what we normally did and try to make this feel like business as usual. So once we had taken the public health message and tried to interpret it and moved with it, and tried to move with it with every single event that we delivered, then we had to go back to the, like I said, the sort of meat and vegetables of stakeholder management. So how do we look after the people who are participating in our events? So game staff and visitors. So how do we look after those cohorts and know that they're different? So trying to balance, as I said, the influence that government were having on us, but also trying to take the front foot and influence policy making there, trying to maintain local safety, so not allow a national issue to become a local risk. And then the constant balance of the responsibility that we have, that when we host people into our organization. So we don't live in an island. We don't just play 11 English footballers against 11 English footballers every Saturday. So you're always moving with the expectations and the shared responsibility of those people coming into your building. And so the part of adopting a stance as an expert voice to national policy making is also balanced by the responsibility of delivering sport in our area of London. And part of hosting other organizations into our building is to understand that all those cohorts are different. So this is now what we're learning, having gone from what was essentially a public health problem that was very, very concentrated in the City of London at the start of this. And there was an enormous national lockdown that we were emerging from, to now, as we go into the second surge, dealing with a proper, well spread out national pandemic, and understanding that actually within that, because of the different biosecurity measures in sport, because of the different prevalence of different people coming into our building from the communities that they've come from, and having a responsibility to look after our staff and look after the people coming and playing there and the visitors then, and thinking about what opening our doors again will look like, is trying to understand how we balance all our testing and screening against that really varied cohort risk analysis as they bring in. And so again, you go from something that is very, very complex, that sort of multi-partite risk analysis to do with clinical prevalence of COVID and the people that you're bringing in. But actually then just taking it back and saying, we stick to the systems that we have, stick to the command control gradients that are well practiced within our organization, and make sure that you're learning and taking advice. And so today we held our weekly COVID steering group. And again, that is people from all parts of our organization learning from the week behind us and feeding forward to the week before. So as we take medical services from behind the scenes to front of house, and that goes on further, I think probably that is the strategy that we have to continue to learn, to try to move with the dynamic situation. And I'll hand over to Mark Cutler, who's the medical operations manager for the group, and he is a paramedic, but also and lecturer, but also the person who is tasked with not just developing this policy with me and the rest of the team, but also with implementing it properly as we go forward.
Just taking myself off mute. I've been to many a meeting so far, and it's been speaking for a good 5 minutes before someone reminds me that I'm still on mute. Yes, Mark Cutler, paramedic by background. First, before we started this, we went into lockdown. We started to have to read a lot of information about viral transmission, pick up from the medical journals. They were kind of outputting lots of information that was relevant to COVID, started to steer the ship into the direction we were going. And that proved invaluable when Liam come back to us and said, right, we're getting football back. What's the best way of doing this? And we were able to then take a lot of the information that we'd kind of gained and learned from the medical journals, from the research that was being done, and start to then implement that into kind of helping the events team and everybody else kind of get this up and going. And initially people thought, no fans, this will be easy. We're used to 90,000 people, maybe one too many lagers every now and again, and a few people falling down. But it turned out that actually it was more difficult to put on an event with no fans and COVID measures than probably it was with a full crowd of 90,000. When we started, we needed to get everyone around the table. So everybody that was involved in putting on an event, and I highlighted a few people there. We need to get around the table to make sure everyone understood the common goal, and then to set out some of our COVID measures or matters to make sure that people understood why we couldn't do things as we'd done in the past, or if we could, why it was safe. And again, then offer up to everybody that was going to be attending these events a safe place of work and sort of somewhere to come and sort of be able to put on a great event without being concerned of spreading the virus. We set up sort of a range of weekly meetings, Teams and video conferencing certainly come at the forefront of this, because again, we were all kind of working from home. No one was really in the office. And that was the steer at the time from the government. So again, it proved another challenge in making sure communication was kind of there, and everybody was on the sort of same page for what we were trying to set up and trying to sort of work out what we were doing. Then you've kind of got everybody on this screen, and they've got a lovely little hand up icon. But again, people were trying to put their point across, and it was making sure that we kind of drew from everybody at the time. We put an idea forward, and then we really need to establish the pitfalls on it. Things that worked in the past didn't work because of close contacts, people with potential asymptomatic transmission. So again, every time we kind of moved forward with something, what we found was there was a few more stones to unturned to try and work out that we'd got it right, and what we were doing was sort of safe in keeping with the kind of constantly changing government advice, the constant changing kind of evolution of COVID that we kind of found as well, to make sure that, again, what we were doing was safe, that we could keep sort of sport going. We kind of ended up bringing in a lot of questions. What we were doing, we was kind of using the Joint Emergency Service decision-making model, looking at the legalities, were we kind of within what the government had set out, to make sure that, we were effective in everything that we'd done. One of the first things we done was we realized we were going to bring a lot of people to site. The teams were okay. They were on constant twice a week COVID testing, but actually everybody else coming to site, so catering, broadcasting, security, even the medical staff, just bringing them into site. There was a lot of places that just sort of beat a temperature thermometer at their heads and said, yeah, your temperature's good. We kind of looked at this, sort of brought it down to look at, and thought, actually what we need is a structured medical screening facility. The reason for this is, as you got to the door of Wembley, this was on the outer concourse, you kind of were met by medical staff in full PPE, which started to set the tone of what we wanted to do at the event. No one entered the sort of starting block there without wearing a mask. We educated quite a few people on what was back to front, upside down, inside out with their masks. And so then they moved into this tent with a very sort of structured questionnaire. We then measured everything from pulse rates, rest rates, temperature, and then we looked at pulse oximetry as well, which we were kind of questioning as to why we were looking at sort of more than temperature. And what we found is from some of the journals and from the information was actually there was kind of a bit of what we termed silent COVID, where actually you'd end up with respiratory problems with no temperature. So what we were trying to do was kind of set the tone to make sure everyone knew that they were coming into a sort of a low risk COVID environment, and then to try and screen out without going to sort of full COVID testing with everybody. And again, the sort of feedback we kind of got on this was people sort of felt, actually, yeah, I feel like I'm coming to a safe place, that I can operate, I can work. The other thing is the medical staff were all sort of very jolly, even though they were there for sort of quite a few hours of the day. And it acted as a good communication piece with everybody coming to the site. It also allowed us to gain all the information for track and trace. So should we then have an outbreak, should we have someone come back and tell us that they were positive, we could quickly access the information, look for close contacts through this system, and then move forward to sort of identify any issues. Then within this, we were working within a building. We would normally run on the field of play. We would deal with people as spectators. But what we needed to do now was work within the constraints of COVID. So, within this, we needed to work within our PPE. And this threw up a lot of challenges. We needed to then practice to make sure we could get it right. It was interesting because the guys started with goggles for eye protection. there was a lot of people wearing them on top of their head. And I said, why are you doing that? And they said, oh, because they steam up, Mark, when I go on the pitch. And I was like, well, they're going to steam up when you get on the pitch. So there was a lot of learning that we've done through sort of simulation, through training exercises. And this was both on the pitch and again on the concourses outside, from tabletop exercises through to more sort of concentrated full simulations, to sort of just test what we were trying to look at, what we were trying to do, to make sure that it kind of worked. And again, there was odd bits and pieces that we'd learned from debriefs, post events, to sort of say, actually, that didn't quite work. Let's go back to the drawing board. Let's see what we can do next time to improve what we're doing. Likewise, we moved sort of some of the equipment because it didn't fit in with PPE. We had a lot of people at the time running onto pitches with very flappy aprons, because that's what Public Health England had said we should wear, because that's what they're wearing in hospitals. But that didn't work for us. So we went to fluid resistant tops that you can see the guys wearing on the pitch, because that then made for better PPE. So we were kind of in this constant evolving kind of learning kind of process. So the thing was, we've offered 11, 12 behind closed doors events. They've all gone really, really well. We've continued to sort of learn from those. Now the next bit is we're now kind of facing that pressure of what's next. We're fairly sure COVID's not about to go away. So where do we step to? And now we're beginning to see sort of quick tests coming to the market, 10, 15 minutes, and we can tell you if we've got COVID. And that sounds great. And this is sort of where the pressure is being applied now is can we apply this to a crowd? How many people can we get into Wembley with rapid testing? What's the pitfalls? What's going to work? What staffing do we need? What's it going to cost? These are all the things that are now being thrown at us. But we're now beginning to look at, actually, we can do this behind closed doors. We can bring fans in, we think, with some social distancing measures. But again, some of the difficulties is when people are leaving. How do we keep social distancing then? How do we load the trains? How do we kind of move people from their home back to their home after an event? And again, with the rapid testing platforms, this is now we're beginning to sort of break this down, look at what might be the fans' journey. Do we need them to come to the stadium the day before to get a test? If we do that test the day before, is it still valid? Would they gain enough virus the next day to then prevent them from coming there, or we could end up with a local outbreak? And so there's a lot of sort of a thinking. There's some crowd modeling going on at the moment to sort of see how this would look and what we could do to sort of make sure we can do this effectively. And our anticipation now is that what we're likely to do is, once we've got these platforms, we've okayed them with the science, we'll then look to small crowds working up. And again, some of the other things that we're kind of looking at that gives us concern is if you rapidly test, say, 40,000 people to come into a venue, they can all come in, they can all sit together, they can all cheer on their favorite team. But then you've got to then change the mantra and the mindset when they leave back to a socially distanced COVID kind of world. So again, we've kind of got to look at all the aspects that come into this to then try and work out, is this a right way to go? How long is this going to last? And what's the right sort of playbook? What's the next chapter going forward? So that's kind of from where I'm at. I'm going to move over and let Tom White take over. And as mentioned, he's our health and safety guru at the stadium that kind of made sense of some of the ramblings we come out with.
Good afternoon or good evening, depending on where you are in the world. So yeah, as Mark's very kindly said, I'm the health and safety manager for Wembley. I've been at the stadium now for about 4 years, and I think this is undoubtedly the trickiest year. So in 2019, we had a 9-week period where we had 1.25 million people through the doors in terms of spectators. We're probably approaching 9 months now where we're not going to have a single spectator through the doors. But obviously, in spite of that, it's been extremely challenging. I'm just going to go through sort of very, very quickly in terms of the approach that we've taken. As you've heard from Mike and Mark, this is very medical led, but what we had to do from a health and safety point of view is take it back to the kind of plan, do, check, act process in terms of being able to plan the process that we're doing, the activity, which was the behind closed doors events, and then obviously do them, check them, and then act and make improvements. So obviously, the first thing, as we've touched upon before, is deciphering the guidance. This was the key part of our plan process. So we took the information that we got from Mike and Mark, which was invaluable, but then we also had to decipher a lot of different information from a lot of different bodies. So that was both sporting bodies, such as UEFA, Premier League, the FA, but then also enforcement bodies, such as the HSE, our local authority, and then bodies like the Department for Media, Culture and Sport, ECMS. So if we kind of click through these, one of the main things was obviously taking all these different bits and pieces and working them into our risk assessments, working them into our methods of operations, our SOPs. But then one of the key difficulties was also, and hopefully you can see it just down on the bottom right-hand side in a moment, was deciphering some of the silence. So some of the areas where we weren't getting guidance from either government bodies or we weren't able to seek guidance just because it was such a new and novel virus that we didn't know much about. And just to give one example of that, on the sort of 22nd of September, we'd been planning to bring back a test event at the stadium for up to 10,000 people. And we were kind of full steam ahead with our planning with that one. On the 22nd of September, our Prime Minister Boris Johnson came out and said, due to a changing COVID landscape, we would unfortunately have to have more national restrictions. That wasn't spelled out in terms of how it would play to events and to sports. And we were told that the Culture Secretary would be on later on in the day and update us in terms of the impact that that would have on our test events. We're still waiting for the Culture Secretary to actually tell us directly about the impact, but we've had to obviously seek that guidance and seek that knowledge from other places. If we can move on to the next slide. So this was kind of a do process. So once we'd done all that, once we'd brought together our risk assessments by working together with our stakeholders around what we did with face coverings, around what we did with hand sanitization and overall sanitization and specific working areas, keeping people separate and all those kind of things, we had to really sit down and work together with a working group and work out how we were going to get that information across in a way that everybody who was coming to the stadium as part of this working to get behind closed doors events up and running would be able to understand it, would be able to go through it, would be able to ask the right questions, and then also be briefed in terms of if you do have symptoms, don't turn up, briefed in terms of some of the basic things like we are going to offer free parking for everybody compared to putting people on public transport, and then where you need to go, what you need to do for medical screening. The two main things that we produced were the stadium operations policy, which is just on the right-hand side there, which was basically a list of all the control measures that we were putting in place for people, how they could comply with them, and what we could do in terms of making things better as part of continual improvement. But then also in the bottom right-hand corner, again, utilizing sort of Microsoft Teams and Microsoft Sway, as everybody's doing nowadays, the behind closed doors induction. So everybody knew exactly what was expected of them before they arrived at the stadium. That's brought some real good opportunities for us because it's helped us to utilize some technology that we've not used before to really, implement the planning process and communicate it through to our stakeholders, which has helped us a lot. If we move on to the next slide now, we've got the check part of the process. So this is a picture of the FA Cup final at Wembley. So as you can see, it's a very, very different kind of thing to what we've seen in the pictures and the videos that Liam showed before. We've got no spectators. We do have two different broadcast teams. We obviously have the players, we have the event owners, we have the club owners, but that's pretty much it. So everybody who's in the stadium has an operational role to be there. But as part of that, we need to make sure we don't get complacent. We need to make sure that everything we've said we're going to do, we do. We need to make sure that everything we've planned to do is effective and we keep up to date with what we're doing to make sure that we can control COVID as much as we possibly can and offer such a safe venue as we possibly can. So with that, we've completely revamped all our pre-event inspections. Every one of our pre-event inspections now includes things like our hand sanitizers in the right place? Is there access to welfare facilities? Is everybody got face coverings and all those kind of things? Are they all available? And that's obviously key. We're also monitoring incident reports and we're doing proactive incident recording and monitoring. So we have a team of fire and safety officers who go around the stadium pretty much all the way through events to ensure that everybody is complying with the control measures as we go through. Obviously, the engagement with all our stakeholders is vital. We can't achieve any of this without working with everybody who works into the stadium. And that can be up to 650 people, as I say, but for behind closed doors events, everybody with an operational role, and they're all as vital as each other in terms of controlling the spread and the risk of this virus. And then one of the key things that we've found with having kind of behind closed doors as business as usual, as this slide is titled, is we can't forget the business as usual hazards that we've got. So we can't forget the normal health and safety hazards, which might get overlooked because everybody is so focused at the moment on COVID. So we need to ensure that fire and egress routes are replanned if we've got areas that aren't open of the stadium. We need to make sure we're not overlooking things like broadcasters and platforms that they use, the working at height hazards for the setup and all that kind of thing. Because if we do, then those could have a much more immediate risk compared to what we've got from COVID. So we just need to be aware, and we need to not forget everything that we've got going on. If we move on to the next slide is around the act. So what do we do once we've undertaken the event? What do we do once we've collected all that information from audits, from inspections, and all those kind of things? And with behind closed doors games, one of the things we immediately noticed is Wembley is very different. We have finals, so our first 3-4 events were all finals, whether that be FA Cup or promotion finals. And for these players, for these team owners, these are the biggest games that they'll ever participate in. So we were getting a lot of people who wanted to be in different places, so our amber zones, our red zones, and all that kind of thing. And very quickly, we saw it. Very quickly, we realised, right, okay, we can actually put people into slightly different areas of the stadium where they can enjoy the event from that working capacity that they're in, but it wouldn't compromise the COVID controls that we've got. We also, as I'm sure everybody's getting at the moment, a lot of commercial partners are looking to see where they can create further value in the deals that they've got with the stadium and with the sporting entities without actually being able to bring people in. And so we're doing a lot of collaborative working in terms of what we can do. And this has worked out really well. So we've got things like double height LED boards now. We've got LED steps, which are things we wouldn't be able to do as it stands with spectators in the stadium. But we may actually now be able to work on ways that we can introduce and we can integrate that into the stadium in a safe way with spectators further down the line. So that's been great. And I know Liam's going to talk about kind of what the future holds, or what the future hopefully holds, in just a slide. So I don't want to steal his thunder too much, but just in terms from a health and safety point of view, looking ahead to what we've got, we're already looking at further government guidance. So we're looking at SGSA guidance around bringing spectators back into stadiums. So hopefully we'll be able to make some work with that in the early new year. Obviously, as Mike and Mark have said, the COVID landscape is extremely challenging in the UK at the moment. So we're going through further national controls, and we're working very closely with our local authority public health bodies to ensure that we are doing everything we can as a stadium to ensure the safety of everyone who works there and who's coming into the stadium. But also we're taking some time out to really do some horizon scanning, to look ahead at what could be the future hazards and risks that we could face, and how can we actually turn those threats into opportunities. So just one example would be looking at the events industry. The events industry is unfortunately losing a lot of really good talent, and a lot of talent that have been there for a good amount of time. With that loss, we're going to lose a lot of competency, a lot of people who are really well trained and able to deliver events in a safe manner. We need to start horizon scanning and looking at how we can look at that and take those real threats and move it potentially into an opportunity, in terms of we can now get the new staff that are coming in and ensure that all those bad habits we've had previously in terms of working in an unsafe manner don't happen anymore. We're making sure we're setting the benchmark and doing things safely from the very beginning, and something that can really roll forward. And that's a real key part once we look at post-COVID and how we can improve both the industry and the way things work. And with that, looking to the future, I'll come on to Liam.
Thank you, Tom. So the future. So I'm just going to quickly wrap up everything we've done and pick up on one of the questions I've seen that's come in. If you could go on to the next slide, please. I was asked about where we're at with return of crowds. You may have heard Tom say that on the 22nd September, we got dealt that blow that said that everything was put on pause. We're ready. We've done the work. We've done all the calculations. We've done everything we need. We've done the journey for the customer and everything that's needed on that. Similar to our colleagues in the NFL, who've kind of come in capacities around 17,000 of a 60,000 stadium. For us here, by the time we did a COVID secure mapping of the venue, and that accounts for spacing in the seats and also movement on the concourses, we're only at around 22,000 people is all we can get in under a COVID secure venue. But we're ready for that. And we've already had that feedback from the States that still has an impact. That's an atmosphere in there, and that's still offering. The new code of conduct, we had to change, get that message across to the customers that this is what we now expect of you, coming in For us, face coverings is you will wear a face covering whilst inside the stadium. People think it's outdoors and think they don't have to, and it's not that. This is our safe environment. The sofa to sofa. So when we're talking to customers, it's like, okay, so if they want to come back to an event, how do you encourage them to come back to your event? You encourage them by showing how good you are and what your safety is. So you start to look at videos of the actual journey and let them see inside. Don't become Willy Wonka's factory with the gates closed and people not knowing what's going on the inside. Show them what's going on the inside. Show them all the measures and all the work that the teams have done over the last few months. Behind closed doors was one step and it helped us understand it. You've heard from the team going through everything, trying to interpret the information and the guidance. You know, we've got to a point when we understand in the current world where we sit, but we need to explain that to the customer what that's like. The technology, you know, we're all almost a cashless venue anyway, but now we can go fully cashless. I think it's just the Hawkers was the last bit of the jigsaw for that. So we can do that. Searching over in the UK, we have quite tribal football fans who can be quite disruptive. So before they were on pat down searches 100% when they're coming in. Can't do that now. So we're now, again, using information gained from the NFL, switching to mag arches, and we've now got mag arches everywhere. So it's an investment, but it's a required investment on that side. Airflows, you hear all about the BMS systems in the stadiums, but you've got to explore that. Look at the technology partners that you've got. We have one company works with Venue Pro, who have several modules that we just weren't looking at, but now we can actually start to look at that. It's the same again with Honeywell. Again, there were systems that they've had there that we've only been using 10% of. And typically, if you buy something, you kind of read the manual and then use 10%, probably have a knowledge of another 20%, but 70% sitting there dormant. So you're bringing that now to the front. And how do you actually turn your stadium around? And then, as I said, the last thing there is remember everything we've learned over this period. This has been the biggest learning period in my 30 years in this business. I've learned as I've gone along, as we all have. We get that experience. But in such a short space, we've all had to learn things that before we relied on other people. We knew that they knew what they were doing, and we just listened and accepted that it was being done. Now we have to understand it because we all have board members asking the question, and like the guys asked then, when are you going to get a crowd back in? I'm hopeful now that with some of the testing modules that might come in, by the time we reopen as a stadium, our last event this year is November the 18th. Our first event of the next year is at the end of February. I'm hoping something happens in the rest of our environment in the UK, that whether it's testing, whether the government have allowed us to go back to this COVID secure venue, so that by the time we get to those events, we have a crowd back inside the stadium. Premier League are a big political weight and they will be pushing because for those over on the UK and Europe side, you'll have seen they're pushing that. We're ready to implement with the team and the way the team have led things and the guys that you just listened to. I'm in a very fortunate position to have them working with me, and the other guys I've got, my safety officers, my head of event operations. Everybody understands now what this new COVID world is. And even when the vaccination comes out and what we've got, there's many things that we're bringing in for COVID that will remain in because they're good things to have, and customers will still seek safety. So we can't decide that, okay, the vaccination's here, we can just revert back to normal. The old normal is gone. It's gone altogether now. The new normal will be going through as we are now, but even post, we will be better venues because entertainment venues are always at the top of learning for safety, delivering safety, and allowing people to have escapism because that's what they want. They want to come to a venue and escape from their normal life and enjoy what you're delivering. And you do that by those 3 S's that many of you work on: safety, security, service. You make sure they're dovetailed and you deliver. That's us. So thank you very much for your time. I'll hand over now to Till and we'll pick up any other questions.
Thank you. That was a great presentation. Really a remarkable multidisciplinary team that's sort of faced, probably lots of challenges before COVID together, and now a unique set of challenges. Liam and the rest of the team, as was evident in one of the slides, you've got a much larger team that you deal with who all have their own issues to deal with, both from an operation standpoint and then personally, and their risk concerns. A couple of questions. We don't have a lot of time, but one of the questions got answered at a more technical level. Maybe I'll turn to Mike because there's a couple of questions that focus on screening of inbound fans, screening of inbound staff related to testing and temperature, And I think you and I recognize, all of us recognize, there's no perfect screening method, as you found, as Mark pointed out, as you probably found some COVID cases only based on their pulse oximetry. So I don't know if you have any thoughts on your screening methods and what you're looking at going forward.
Yeah, I think it's interesting, isn't it? We were probably considered the most sort of not I wouldn't say robust. I think, and we made the right decision to have a multifactorial screening process. So we thought probably the biggest hitter in this, as far as being able to be implemented, was pulse oximetry and a questionnaire. And so if you can take a decent protocolized history with key points and do the pulse oximetry on somebody, we felt that that was probably the thing that would cover most of the issues that we had. I think it's also worth remembering that, you know, we've learned so much more in over a 5-month period of time, right? Certainly temperature checking was so ubiquitous at the time that we started doing our screening that I think there were 2 issues with that. One is that none of us were entirely convinced that the technology in that setting was perfect. Although, you know, in pretty awful weather, we're using that particular hardware all the time pre-hospital, and don't have huge variations with the stuff that it's reading off in our ward area, because we essentially have a in situ hospital bay within the stadium. But I think the one thing with temperature screening as part of that was it was almost impossible to get rid of. Because there's an expectation, and there's just it's become one of these signals that you're entering a screening area. So there's an expectation that that is part of the screening. And I would say, from a human factors and buy-in point of view, you know, that in itself is fine, even if there is a placebo diagnostics component to it. But the second part of it as well is that, you know, it does pick up febrile patients, and even if there are variations in it, the important bit about our screening process, and the thing that we're lucky about, is that we've always had our backup protocol is that if anyone sits outside either the questionnaire bits or the screening, then they get a medical assessment that is more detailed. So you move those people away, and you know, maybe they're only 5% of all the people that you screen, but then they have a more robust assessment. And in doing that, you're cutting the wheat from the chaff. It's a more sensitive but less specific screening process, but you have to have the personnel to do it. Because as Mark is always telling me, the key thing about screening is and this applies then to the next question about on-site COVID antigen testing, which is obviously sort of exploding as far as people's interest in it is concerned, is that if you do open your doors and you do decide to test people at the turnstile, what do you do with the person that tests positive? How do you assess them safely? How do you extricate them back to their home or the hospital in a way that is non-injurious to your business continuity and is safe for that person? So I think all screening for me is to do with how much screening you do and what level of screening you do into risk mitigation, not risk eradication, always risk mitigation. How much do you want to drill into, depending on what level of expertise you have to do that risk management on site? And we're lucky because we have a number of physicians and paramedics and clinical nurse specialists who can do that level for us. So for me, screening, the whole screening piece, then the adding on-site testing or testing within prevalence populations, it's just extrapolates from that. It's just a build up from that screening process that we already have. And I think that's the important thing about it. We can't look at novel testing platforms as an alternative. All it is it adds on to the system that you already have. And if that, I don't know if there was any other sort of specifics around that you were interested in exploring.
No, I think you point out the difficulty in this, because we all have been learning here, there, and everywhere. We've all been learning about how to both screen for illness and try to manage operations both in a healthcare environment and then in a stadium environment otherwise. And you think you've laid it out perfectly. What you're doing now is different from what you're going to be doing in a few months, because the equipment's going to get better, the information's going to get better. So that's very, very well taken. I think.
Sorry, the one thing I was going to add is that the key issue around these testing modalities, there's so much that we're in the fog of war again, aren't we, when it comes to the testing modalities? But the key issue is the understanding of what is your risk at an event, at creating an outbreak. And your risk is the person who is infectious but asymptomatic, and who has no signs of illness, right? So it is understanding these rapid antigen testings about how long they buy you. And that's really it, isn't it? How long can you be absolutely sure that a negative test is going to mean that person doesn't become infectious 3 hours later when they're halfway through an event? So I think it is about understanding how long it buys you. How long is a negative test still a negative test? And if we tested 90,000 people coming out of the stadium, how many would test positive having tested negative 7 hours previously? And I think we're not quite at that place yet with any of this technology, even the most regularly used ones. And I think that's what we're waiting for in the event business. We're waiting for vaccines. We're waiting for the world to change. We're waiting for a miracle, like we all are, right? But I think when it comes to novel testing technologies, it is about that window of vulnerability. How long does it buy you? And I think it's going to be hard to be an early adopter of that technology if it's the only thing that you rely on.
Thanks for that. So we have gone a few minutes over, and this has been a great conversation. In the context of, I don't know if all of you saw it, but along my computer screen, a note that France and Germany are now increasing their restrictions based on disease dynamics. I'll kind of turn to Liam for any final thoughts about the challenges you face in a very important, iconic venue within London, and really a well-known name around the world, and your final thoughts on what your team has presented and your plans going forward.
Reputational damage is huge. We're the national stadium. Like I said, we're known throughout the world. So it was really important that we ignored some of the pressures that were coming in to try and deliver events. We want the events back, but this is when I said to you before at the start of this, the medical team now suddenly jumping to the front of the planning team, so listening to their advice is really important. It's also understanding that while somebody can come out with this new testing and say, okay, I can tell you can go to 50% capacity in your venue, so you can have 45,000. You have to be aware of your external stakeholders and what that means to them. So as Mike pointed out, our local authority were really under the cosh when this all first started. So for them, understanding was something going to allow 45,000 people into the stadium. Are they going to be happy with that? So they're integral to all of our conversations. The transport links, as I showed you that first photo of the stadium with all of those high rises around us, we have space for 2,800 cars. That's it. Everything else comes on public transport. So can the public transport cope with 45,000? Right now, no, because that rapid testing, where is that taking place? Is that taking place by your venue? Is that allowing them into there? Do they have a system that they're going to have one carriage that's available for everybody who's got a bio that says green? It's not going to be that at all, because they're still going to be operating under social distancing on that side. So there are so many challenges with all of this, but it's what I'm really happy with is the team I have interrogate everything that comes into us. We never take the first bit of information as gospel, because you just can't. So they go interrogate, they talk to other venues. So forums like this are really, really important for me, because it opens up connections. I've never known our industry to become so small when it comes to actually contacting each other and collaboration. The silos we all used to operate in, that we all thought we knew best, we all now know that we don't, and we all talk to each other for guidance. And that's the bit that's got to continue, and we'll do it. And as a national stadium, we want to help other venues in the UK, but we'll also listen in case I've got a nugget. But with them, as Mike said, we'll talk to all the people that are either ahead of us or have different learnings. And that's the bit that I would always push forward for anybody, is that we have to keep these forums up, because we all have some brilliant experts working with our teams to talk to other teams. That's what will make this industry come back. It won't be governments, it'll be this industry finding its way through it. and finding out what the best solution is and looking at that bigger picture rather than just going in with blinkers on at certain areas.
And with that, I really, as we close today, I want to thank all of you from the team at Wembley for joining us and sharing your insights on some really vexing challenges that we're all facing related to COVID-19 for the sports and entertainment industry and for society in general. On behalf of the Innovation Institute for Fan Experience and Aveshka, I want to thank each of you for joining us for today's forum, and all of you for attending and listening and for your questions. Each of you can now join IIFX and other sports and entertainment fans and professionals as we build a path to return, work, play, and spectate. You can find more information at iifx.org. Please remember to join us next Wednesday for part 3 of this, COVID-19, how to manage medical risk at sports and entertainment venues, COVID risk playbook, which is our continuing 4-part series created by the IIFX Medical Task Force. Please remember, we're exploring how sports and entertainment communities are responding to the ever-evolving and really rapidly evolving COVID-19 pandemic. Every Wednesday at 12 Central Time in the United States. Any of you who registered today will be automatically registered, and please look for invitations in your email. You can also subscribe to our Return to Work, Play, and Spectate podcast for more discussions, and be sure to follow us on social media at IIFX_global. Thanks again for joining us, and have a great weekend.